For metastatic bone disease, evaluation is important. The most common metastatic bone tumors are metastases from the prostate, breast, lung, kidney, and thyroid. The prostate has blastic metastasis, while the breast is mixed. GI tract is also mixed sort of metastasis. Lung and kidney are mostly lytic. Osteolytic lesions are developed due to activation of osteoclast or by tumor cells, which releases PTH-related polypeptide. Osteoblastic lesions developed because the tumor secretes endothelin-1 and transforming growth factor beta. Regarding evolution of metastasis, never assume solitary lesion is metastasis. I will do blood investigations that consist of full blood count, urine electrolytes, LFTs, bone profile, myeloma screen, CRP, and ESR. Tumor antigens can be also assessed, which helps in monitoring. CEA, chorioembryonic antigen, is for colorectal CA, C19-9 pancreatic CA, CA125 for ovarian CA, CA15-3 for breast cancer, PSA for prostate cancer, and AFP, alpha-fetoprotein, for hepatocellular carcinoma. After the blood investigations, I can do a CT scan of the chest, abdomen, and pelvis for look for primary, MRI of the extremity or the lesion to identify and assess the soft tissue component and neurovascular involvement. For a spine, I would prefer to do a whole spine MRI. Once an investigation is done, before a surgical fixation of a fracture, a biopsy is indicated. I will discuss the patient with MDT team. Regarding the spine, there is a Tokahashi score. Tokahashi score is a primary prognostication of spinal metastasis, which consists of 5 things. First is general condition of the patient, which is Karnofsky score. Number of spinal and extraspinal metastasis. Number 3, visceral metastasis. Number 4, primary cancer site. And number 5, neurological involvement or abnormality. The treatment aim is to control the pain and prevent neurological deterioration in spinal cord injuries. A referral to MDT and neurosurgical approach should be done. Regarding a fixation, a prophylactic fixation is indicated if Myral score is more than 8. If Myral score is more than 8, this means the fracture risk is more than 33%. Myral score consists of site, size, pain, and lesion. Site can be 1 for upper limb, 2 for lower limb, 3 for trochanteric region. Size can be less than 1/3, less than 2/3, or more than 2/3. Pain can be mild, moderate, or functional. Lesion can be blastic, mixed, or lytic. Some of the tumors metastasis may respond to radiotherapy. Direct decompression surgery for the spine plus post-operative therapy is superior for radiotherapy alone for spinal cord compression causing metastasis.